Hello and welcome. Today we're discussing a serious ocular emergency: chemical burns of the cornea. These injuries can have devastating consequences on vision if not promptly and properly managed. Join us as we delve into the causes, effects, diagnosis, treatment, and prevention of this critical condition. So, what causes a chemical burn to the cornea? The most common culprits are alkali substances like ammonia, lye found in drain cleaners, and lime used in construction. Acids, such as sulfuric acid found in car batteries, can also cause burns, though these tend to be less severe due to the formation of a protein barrier. Solvents and detergents, while often less potent, can still irritate and damage the cornea, especially with prolonged exposure. These chemicals can splash into the eye during industrial accidents, household mishaps, or even intentional acts. When a chemical comes into contact with the cornea, a cascade of events unfolds. Initially, there's direct cellular damage. Alkali substances penetrate deeper and faster than acids, causing saponification of cell membranes and destruction of corneal and conjunctival tissues. This can lead to stromal edema, ulceration, and even perforation in severe cases. The inflammatory response kicks in, releasing mediators that further contribute to tissue damage and scarring. Blood vessel growth into the cornea, known as neovascularization, can occur, further impairing vision. In the long term, severe burns can damage the limbal stem cells, which are responsible for corneal regeneration, leading to chronic epithelial defects and persistent inflammation. Chemical burns of the cornea are unfortunately not uncommon, particularly in industrial settings and homes where hazardous chemicals are used. Specific data on prevalence and incidence vary depending on geographical location and industry type. However, studies consistently show that young males are disproportionately affected, likely due to higher participation in occupations involving chemical handling and a higher propensity for risk-taking behavior. Prevention efforts are crucial to reduce the burden of these injuries. The signs and symptoms of a chemical burn can be immediate and alarming. Expect to experience intense eye pain, a burning sensation, and excessive tearing. Blurry vision is common, and in severe cases vision loss can occur. The eye may appear red and inflamed. You might notice swelling of the eyelids and conjunctiva, a condition known as chemosis. In the most severe cases, the cornea may appear hazy or opaque, obscuring the iris and pupil. Diagnosing a chemical burn relies on a thorough eye examination. The first step is to take a detailed history noting the type of chemical involved, the duration of exposure, and any initial treatment administered. Visual acuity is assessed as soon as possible. The eye is then carefully examined using a slit lamp, a specialized microscope used by ophthalmologists. This allows for detailed evaluation of the cornea, conjunctiva, and other ocular structures. The pH of the ocular surface is measured to assess the severity of the burn. The presence of corneal epithelial defects and stromal haze is noted, and the extent of limbal involvement is carefully evaluated, as this has significant implications for prognosis. Chemical burns of the cornea can be classified based on their severity. One common classification system is the Roper-Hall classification, which grades burns from grade I to grade IV based on corneal clarity, limbal involvement, and conjunctival ischemia. A grade I burn involves minimal corneal epithelial damage and no limbal ischemia. A grade IV burn, on the other hand, involves complete corneal opacity and extensive limbal ischemia, indicating a very poor prognosis. The primary goal of treatment is to remove the offending chemical and minimize further damage. Immediate and copious irrigation with sterile saline or water is crucial, continuing for at least 30 minutes, and preferably longer, until the pH of the ocular surface returns to neutrals around 7 Ra. After irrigation, a thorough examination is performed. Treatment often involves topical antibiotics to prevent infection, topical corticosteroids to reduce inflammation, used cautiously under close monitoring, and cycloplegics to relieve pain and prevent adhesions. Artificial tears are used frequently to lubricate the eye and promote healing. In severe cases, surgical interventions such as amniotic membrane transplantation or limbal stem cell transplantation may be necessary to restore corneal function. Prevention is paramount in reducing the incidence of chemical burns. This includes wearing appropriate eye protection, such as safety glasses or goggles, when working with chemicals in industrial or home settings. Proper storage of chemicals is essential, keeping them out of reach of children. Clear labeling of containers is crucial. Educating individuals about the risks associated with chemical exposure and the importance of immediate irrigation is also key to preventing severe injury. The prognosis for chemical burns of the cornea varies depending on the severity of the burn and the promptness of treatment. Mild burns may heal completely with minimal scarring. Severe burns, however, can lead to permanent vision loss due to corneal scarring, neovascularization, and limbal stem cell deficiency. Recent research is focused on developing new therapies to promote corneal regeneration and prevent scarring, including the use of growth factors, stem cell therapies, and novel anti-inflammatory agents. Early recognition and aggressive management are essential to optimize outcomes and preserve vision.